In a similar vein, though, it was obviously a busy couple of years for ASTRO and ACRO working on these codes. But we also worked on some other codes, not just the radiation treatment delivery, but also the superficial radiation treatment delivery code set. There's a lot of history there as well, but the agency accepted some new codes and made some big changes there. Could you elaborate on that a little bit more?
Yeah, definitely happy to. One of the other things I did want to make sure we bring up is that because of everything that happened with the treatment delivery and the conversion factor updates and getting us out of budget neutrality and how we get rebalanced, all our other professional codes have all gone up significantly, anywhere from 3 to 10% across the board, whether you're talking about IMRT, SBRT, weekly management, dosimetry, all our professional charges have all gone up also. So also a huge win.
And like, yeah, bigger increases than, well,
Then,
I mean, obviously we've only seen cuts in the past several years, and in
yeah,
Astro, we've never seen increases like this.
no, exactly. So I did want to highlight that. But yeah, to your question, I think one of the other things we as a specialty face is encroachment up in our code set by other specialties, and which is not a bad thing. But what happens is if with the RUC, if another specialty becomes the predominant user of a certain code, then that code automatically triggers a review from the RUC saying that the dominant specialty provider has changed. This code's been flagged. It needs to be resurveyed. And then it's going to be resurveyed by that dominant specialty, which might have a different process of care and different expenses. And so the value of that code can go down. Our codes are valued as high as they are because most of them are delivered in rooms with a vault and with a linear accelerator. So with superficial radiation therapy, what's happened over the years is practitioners on the dermatology side who use their machines to do surface radiation therapy were using the simulation codes, and sometimes daily or very frequently, which we had advised against for years, but they're very lucrative, as well as daily ultrasound guidance. And so what we decided is when these codes now became the dominant specialty was dermatology, and the RUC once again said we have to review these codes. We worked with the Society for Dermatology to create new codes that accurately accounted for the true practice expense associated with the equipment for delivering surface radiation therapy and accurately accounted for the process of care with doing that. And so they now have new codes for simulation, for ultrasound guidance, and for the delivery. And their delivery has actually gone up that represent what work they do. But but what they're not allowed to do now is they are not allowed to bill the other ancillary radiation oncology codes, which don't necessarily apply to surface radiation therapy, such as weekly management, such as our simulation family. And so they're now limited to the codes in their family. So that's also a really good thing for our specialty because it prevents other specialties from coming in and becoming the dominant user and us having to revalue our codes.
Yeah. And we've heard from some folks who might use a lot of ortho voltage, particularly for like non-malignant uh, indications. And CMS in the final rule noted those concerns that folks had flagged for them, and basically just said, like if this new code does not describe what you are doing when you're doing that, there's always the possibility of using an unlisted code. And so those folks who had those concerns were also heard. Um,
Yeah, and I would say that because I practice benign radiation, and I actually have a pretty busy practice doing that, and I use a linear accelerator to do that. So I use photons and electrons, and I'd say the vast majority of radiation oncologists who deliver that care are using linear accelerators. So they will use the new treatment delivery codes 77402 to 77412 for that. But if you're using an orthovoltage system, then you'll use the new X codes for that. And actually, the value of that orthovoltage has also gone up for our practitioners who are using that.